Down there, but you really get a better feel for what kind of doctor you want to be up here. You get a better feel for how to relate to patients, and I feel very comfortable up here, both in academics and interacting with people socially as a future physician. So I
think the amount of individual attention you get in the freshman year is really helpful. That's got to be the toughest year in medical school, and being in a small class with a closer relationship with the professors really helped.
I think Ball Memorial Hospital draws a lot of its residents and practicing physicians from students that have come through the Muncie Center for Medical Education. I know our class this year, 5 out of the 16 students from the Muncie Center have returned for residency positions here at Ball.
I would suspect that without having the experience of my freshman year as a student at Ball State and as a medical student, that I would then not have made all those decisions, and that therefore I would not be here and maybe somewhere else. Because I do enjoy teaching, I do enjoy my clinical practice, I enjoy Muncie as a community and find it as a fine community. I think it would be a very tragic event if we close down the local center here. We will be therefore losing students who may then begin their medical careers here at Ball as interns, residents, and then on our clinical staff.
The Muncie Center for Medical Education was established in 1971 by the Indiana legislature in response to a medical crisis. More than 60% of physicians trained by the Indiana University School of Medicine were leaving Indiana, and of those who stayed, few entered family practice. This left many Hoosier communities without physicians. The solution, adopted by the Indiana legislature, was to establish the statewide medical education system with campuses in 7 cities. The first class assigned to Muncie consisted of 4 students, and they met on the Ball State University campus. In 1975, the second floor of Moriah Bingham Hall, which is part of the Ball Memorial Hospital complex, was renovated at a cost of $500,000 to house the program. The second year of medical school was added in 1982, and the third floor of Moriah Bingham Hall was renovated at a cost of $725,000. Today, 32 first and second year medical students are assigned annually to the Muncie Center for Medical Education, where they begin the pathway to a medical career. The selection of Moriah Bingham Hall as the home of the Muncie Center for Medical Education was not without reason. By locating here, the center provides its students with unusual access to clinical exposure during the first 2 years of medical school. The Center for Medical Education shares Moriah Bingham Hall with the Family Practice Clinic, where students can readily see community-based primary care medicine at work. Additionally, being a part of the Ball Memorial Hospital complex affords the students maximal opportunity to be integrated into the local medical community. Here they can attend grand rounds, use library facilities, and have their imaginations fired as they follow an assigned buddy physician on his rounds in the hospital. Since its inception, the Muncie Center for Medical Education has provided its students with a quality of education that is second to none in Indiana, whether the measure is preparation for the clinical years or performance on standard medical board exams. This excellence has been facilitated by something available at the Muncie Center, which is not readily available at most larger medical campuses. That something is access. First, there is access in the classroom. With only 16 students in each class, professors are readily accessible to students both in and out of class. Small class sizes promote active learning experiences, such as problem-oriented classroom discussions. When students struggle with a topic, the instructor can invite discussion as the class works through the concept together. Outside of class, professors routinely spend time daily with students exploring ideas introduced in the classroom. In the anatomy laboratory, this access is readily seen by the sharing of each cadaver by only 4 students. Unlike students at larger medical campuses, where 7 or more typically share a cadaver, these students are all able to gain valuable dissection experience rather than trying to learn anatomy by watching as one person does the bulk of the dissection. Because the faculty are so readily available to students, and because each class is taught by only 1 or 2 faculty members, the faculty develop a strong sense of accountability to the students. One faculty member recently remarked, "It's my course. If they don't learn the material, it's my fault. I want them to understand what I teach and be able to apply it to new situations. If they can't, I feel I failed them." Second, there is access to research. Few students at larger medical campuses actually see basic science research performed because their instructional time is segregated from the basic science laboratories. Research exposure is important to the education of medical students because it helps them develop critical thinking processes. At the Muncie Center for Medical Education, students are welcome to observe and to participate in ongoing research projects. Here we see Dr. Richard Milton, physiologist, working in his laboratory with a group of medical students. Dr. Milton's work, which is supported by a grant from the National Institutes of Health, is focused on determining how nerves instruct a muscle to contract. His study should provide valuable insight into diseases where communications between nerves and muscle break down. Diseases such as myasthenia gravis and muscular dystrophy. Dr. Milton is not alone among the center faculty in having studies supported by the NIH or other external sources. During the past year, Muncie Center for Medical Education faculty published 17 papers in national and international journals, and during the last 5 years, attracted over $336,000 in external research grant support. Several of these studies have involved medical students. Third, there is clinical access for our students. From the beginning of their medical education at the Muncie Center, each student is assigned a physician buddy at Ball Memorial Hospital. This physician begins the process of introducing the student to the world of clinical medicine. The student is invited to follow the physician on his rounds and may spend time with the physician in his office. Because the Center for Medical Education is adjacent to the hospital, it is easy for eager medical students to spend free time observing in the emergency room or taking advantage of other clinical opportunities. It is here that the student begins to learn firsthand about community-based primary care medicine. The second year of medical school focuses on the clinical sciences, with classes in pathology, pharmacology, introduction to medicine, and physical diagnosis. Now the students spend more of their time in the hospital as they learn history and physical interviewing techniques from the internal medicine staff and begin to see their first patients. Some have already begun their clinical experiences by serving as a summer extern at Ball Hospital between their first and second years. More than half of the students in each class spend at least part of their summer at Ball Hospital, acquainting themselves with family practice, internal medicine, pathology, surgery, or other clinical disciplines. During this time, they participate not only in clinical duties, but they become a real part of the hospital. They involve themselves in the hospital's social programs and compete on summer athletic teams. This openness of the hospital to Muncie Center students builds camaraderie among the students, as well as strong ties with many in the community. Because of the nature of the second year, students are now afforded opportunities to spend more time with their buddy physicians than was possible during the first year. For some, these clinical experiences are in the Family Practice Center, which is located one floor below the Center for Medical Education. The Family Practice program includes an outstanding obstetric clinic where 100 pregnant women are seen weekly by attending family practice residents, with about 500 deliveries per year. In addition, the Family Practice Center hosts about 600 non-pregnancy associated patients per month. Many students who avail themselves of these opportunities for clinical exposure like what they see and return for more. The Muncie Center for Medical Education is the greatest single source of physicians for Ball Hospital residency programs, with about 1/3 of residents yearly at Ball Hospital being former Muncie Center for Medical Education students. Is this pattern of physician retention important to the community? About 35% of physicians now on staff at Ball Hospital received at least part of their medical training in Muncie. How do current and former students of the Muncie Center feel about this program? Let's listen as they tell us in their own words.
Yeah, I know for myself that was one of the big factors for coming back here. I had that initial contact with Ball Hospital and the medical center, medical education program here as a medical student at the Muncie Center. And it gave me a different look on the community medicine versus the campus large medical center program that I got in Indianapolis. And for me, that was a good experience because I much preferred the community setting and plan to practice in the community setting after my residency program.
One of the weaknesses of Indiana University's medical school is probably that Indiana only has one, which is IU. It doesn't have 2 or 3 or 7 or 8 like Ohio and Illinois do. And I think that might hurt Indiana because you don't have the competitive edge that the other schools have in other states with each other. You don't have a heterogeneous group of physicians being educated with different styles, being exposed to different environments. If you churn 265 physicians out of Indianapolis every year, you may not come out with the different perspectives that physicians need to have to be able to deal with different kinds of people in society. I think it's good to have physicians educated in different environments, at Ball, up at South Bend, in Fort Wayne, Terre Haute. I think it's nice to see physicians coming out of different educational backgrounds, and then they can contribute to Indiana society the way they want to, and where they feel comfortable. So.
Well, I think that clearly in Muncie, we see a number of practicing physicians who have gone through community programs. And I would venture to say that in other communities of the size of Muncie, a number of practicing physicians there probably went through this type of program. They're not necessarily attracted to the big city or to research or to university type practices, and that kind of training lends itself to practicing in a community type hospital.
When the Indiana legislature established the statewide medical education program in 1971, its members envisioned a geographically diverse program that would reverse a trend of physician flight from Indiana and would attract young men and women into careers of community-based primary care. The Muncie Center for Medical Education has established a strong record of attracting its graduates back to Muncie for residency programs and beyond. The list you now see are the names of some among our graduates who have stayed to meet the medical needs of Muncie and its surrounding communities. Since the inception of this program, 1/4 of the physicians who have entered practice in the Muncie area began their medical training at the Muncie Center. The Muncie Center for Medical Education benefits more than just the students. It benefits the entire community. These benefits include physician retention in East Central Indiana, the persistence of healthy and diverse residency programs at Ball Memorial Hospital, services such as the free pregnancy clinic, which are dependent upon residency programs, direction of physicians into primary health care careers, general improvement in community health due to a low physician-patient ratio, increased community income due to improved health care, and more. But like a three-legged stool, these successes are dependent upon preservation of all of the supporting legs. That is, the Center for Medical Education, Ball Memorial Hospital, and Ball State University. So long as the legs remain, this trilogy of success will continue. But if one leg is removed, the entire stool will collapse.